y'all, Shelly here with another tip for hospice nurses. So I had a request to do a video on cancer patients. And when I got the request, I really had to stop for a minute and think of all the hundreds of videos I've done for you guys. I've never really done any specifically on cancer. So I'm going to do a little series because there's a lot of areas to cover. So I'm going to talk about general stuff today, and then I'll do another video next week on symptom management, and then one specifically on pain management for cancer patients. But what I'm talking about today is the one thing that all cancer patients have in common is that they have nothing in common. Cancer manifests and presents differently in every single patient. And even the same type of cancer in the same location, even patients that live in the same area, that's the one thing I can tell you is that it's always different. I've had patients with lung cancer that have had a lot of pain. I've had patients that have had no pain. I've had patients with lung cancer that have trouble breathing. I've had patients that have no trouble breathing. I had one patient one time that I took care of him for about 5 months. And for 4 months, 3 weeks, and 4 days, he had no symptoms. In fact, when I would go see him, I'd be walking around his property looking for him because he'd be out playing with his dog or fishing at his pond or something. And then the last 3 or 4 days of life, he just rapidly progressed and declined and passed away. But I've had other patients that have had just lots of symptoms to manage. I've had patients with liver cancer that have had that confusion that I have talked about in the past and have required lots of lactulose to help clear the toxins. But I've had a lot of patients that haven't required that at all. I've had patients with liver cancer that have had a lot of pain, like extreme pain. And I've had other patients that have no pain at all. Patients that get ascites and some patients that don't. In fact, I had one patient one time that ascites was his only symptom, but it was so severe that I would have to see him twice a day. He'd be my first visit in the morning and my last visit at the end of the day because I had to drain him twice a day for him to be comfortable. But other than that, he really had no other symptoms. So the thing with cancer patients is, and my recommendation is that you assess them very well and very frequently. I like to see my cancer patients 3 times a week at least. And that's what our doctor will usually order for the visits. And I think that with cancer, and this is just my opinion, I don't know that there's any studies on this, but this is just what I have observed over the years, is I think that as cancer, the tumor invades an organ, that organ hangs on and works as long as it can and as hard as it can, and then it suddenly gives out. Suddenly the cancer just overtakes it. So we can see a very rapid decline, but there usually are small, subtle signs before that happens. So that's why I like to see these patients frequently. Utilize all of your senses when you're looking at these patients. What do they look like? Are you starting to see a little bit yellowing of the eyes? Or are they getting that kind of artificial tan look that you see sometimes with kidney issues? What do they sound like? Is their voice becoming raspy when it wasn't before? Or what are they saying to you? Am I just a little more tired today than I normally am? I didn't feel like taking a bath. I didn't really feel like eating today. If that's something that progresses and continues on from visit to visit, that could be a sign. What do they feel like? Is their skin getting kind of sandy feeling, like there's some uremic frost there? Or is there some crepitus when you feel their rib cage? So you want to use all of those symptoms like this, but definitely what do they sound like? What are you hearing when you listen to them? Because you can get subtle cues of something that's about to probably be a rapid progression. And I recommend keeping your physician very well in the loop. Like with any little change, notify your physician so that they know what's going on. So if a rapid change occurs and a much more drastic change, they're aware of it. And they've already probably started formulating a plan in their mind and they kind of know what's going on. So I hope this tip was helpful. If you have anything you'd like me to talk about, please let me know. I would love to share it here. And remember, y'all, if we work together, we can change our world.